Hello everyone. My name is Dr. Bukhari. I am assistant professor of medicine and currently a practicing physician in Illinois. Today we'll learn about the drug called Duoneb. It's a combination of IPRATROPIUM and albuterol, uh, and we use this drug commonly in the inpatient setting as well as outpatient. Ipratropium is a anticholinergic agent, and albuterol is beta 2 agonist. We use this drug commonly in asthma and COPD exacerbation all the time. We use them as a breathing treatment for the relief of asthma and COPD exacerbation. Let's discuss about the most common side effects we should be aware about Duoneb, because we use it very commonly, so we should be very much aware about all the common side effects related to this medication. So I will highlight the side effect which I see commonly in the hospital, and I'm sure you guys see it all the time when you are working in the inpatient setting. So number one, so we are discussing the adverse effects. CNS side effects. So this medication can cause dizziness, lightheadedness, because it can cause CNS stimulation. It can cause CNS stimulation. So you should be careful using this medication if your patient has a history of seizure disorder. Because it can sometimes precipitate seizure. It can affect cardiovascular system, especially in patients who have underlying history of heart disease, arrhythmias, coronary artery disease. So the common side effect I see in the hospital all the time after Duoneb treatment is tachycardia. And if your patient has any underlying cardiovascular disease, it can precipitate arrhythmia. So you should be very careful in patient who has underlying history of coronary artery disease, arrhythmia, CHF, uncontrolled hypertension. Sometimes it can cause ECG changes too, especially the beta agonist part of Duoneb. It can cause flattening of T waves, prolongation of QT interval, even ST depression can happen sometime. The next side effect which you will see all the time in the hospital is electrolyte abnormalities. And the most common electrolyte which will be affected is potassium. Your patient can develop hypokalemia because breathing treatment can cause movement of potassium from extracellular fluid into the cell, resulting in a low potassium level. It can cause hyperglycemia also. So if your patient has diabetes, it can be, if their sugar can be high in the hospital when you're using Duoneb, especially the albuterol component of Duoneb has beta 2 agonist activity, which will increase glucose level. This effect is usually transient, it's like a short-term thing. If your patient has underlying history of BPH, benign prostate hyperplasia, Duoneb treatment, frequent Duoneb treatment, you have to be very careful because it can precipitate urinary retention. If your patient has a history of glaucoma, you should be careful because IPRATROPIUM part of Duoneb can precipitate narrow angle glaucoma and increase intraocular pressure. So these are the common side effects. Very rarely, very rarely, I see some patient who develop hypersensitivity reaction to Duoneb, but it's very uncommon. So these are the common side effects you should be aware about when you are treating your patient with COPD and asthma exacerbation using Duoneb. Thank you very much. Have a nice day.